Hi, I'm Sarah and I'm a registered nurse here at Hines VA Hospital. Today we're going to be talking about how to care for your Foley catheter at home. First, what is a Foley catheter? A Foley catheter is a thin, flexible tube that drains urine from your bladder. What are the results going to be? Well, your urine will drain and you will prevent infection. Ask your doctor what you need to do when you go home. Make sure you ask questions if you don't understand what your doctor says. This way, you will know what you need to do. Your doctor may order a home health nurse to come to your house to help you learn to care for your catheter. Wash your hands before and after handling your catheter. If you switch between a leg bag and an overnight drainage bag, be sure that you clean the connection between the catheter and the bag with an alcohol swab before you switch bags. Rinse your used empty drainage bag with 1 cup of vinegar, mixed with 1 cup of water. Shake mixture around and allow to sit for about 15 minutes. Rinse thoroughly with cool water and allow to dry. Place a cap on the drainage bag that you're not using and store it in a clean towel. It's helpful to have an extra bag ready for use. Now let's discuss care for the catheter. Wash the skin around the catheter with soap and water each day. Rinse well and pat the skin dry. Do not use lotions or creams on this tube. Keep the tube secure. You may want to use Velcro straps or some other device to keep the bag or catheter on your leg. Do not let the tube pull or catch when you're moving around. Do not let the tube kink or loop. Do not clamp the catheter or tubing unless you are told to do this. Next, let's discuss care for the drainage bag. Keep your urine bag below your bladder. Drain the bag often to help keep you from getting an infection. Now, to empty the bag, wash your hands. Slide the drain tube out of its holder. Place the drain tube over the toilet or a clean container. Do not let the drain tube touch the toilet or the container. Open the clamp or valve and drain the urine. When the bag is empty, close the clamp or valve and place it back in the holder. Wash your hands. Next, let's discuss changing bags. First, wash your hands. Empty the bag. Place a towel under the place where the catheter and the tubing connect. Wipe the connection with an alcohol wipe and let it air dry. Pinch the soft rubber catheter so urine does not leak out. Disconnect the tubing from the catheter with a twisting motion. Use another alcohol wipe and clean the end of the catheter, moving away from the opening. Take cap off of new tubing and bag and attach catheter to tubing. Stop pinching the catheter and let the urine drain into the new tubing and bag. Make sure catheter and bag are secure and do not pull. Wash your hands. Wear cotton underwear. Next, please check that there's urine in the bag. If there's no urine in the bag, there could be a kink. Change your body position to help urine flow out. Check the tubing and catheter for kinks or loops. Make sure the tube is not clamped. Make sure the bag is lower than the level of your bladder. What follow-up care is needed? Your doctor may ask you to make visits to the office to check on your progress. Be sure to keep these visits. If you need a catheter for a long time, it will need to be exchanged every few weeks to prevent infection. Next, what lifestyle changes are needed? Drink 6 to 8 glasses of water every day. Take showers. Do not soak in a bath, hot tub, pool, or other body of water while the catheter is in. Next question, what problems could happen? The catheter has a balloon to hold it inside the bladder. The balloon can break or leak, and the catheter can fall out. Urine flow stops or is blocked by kinks or bends in the tube, or if the drain bag is kept higher than your bladder. You may see blood in the collecting tube or bag. Sometimes the blood can make clots that can clog the catheter. Bladder infection, irritation where the catheter goes into your body, skin irritation from the straps or tube holder. These are all complications. When do I need to call the doctor? Call the doctor if you have signs of infection like a fever of 100.4 or higher, if you experience chills, pain around the catheter, redness or swelling of the skin around the catheter. Call your doctor if urine has blood in it or is dark, coffee colored, has bits of tissue or other objects in it, or if the discharge is pus-like. Call your doctor if the tube comes out or urine stops flowing. Call the doctor if there's burning or painful feeling in your bladder. Know that Hines is here for you. We have a 24/7 VA nurse triage line here at Hines. The phone number is 708-202-3800. Thank you for choosing your care here at Hines VA Hospital.